So a trigger point is essentially a knot in the muscle that keeps the muscle in a contracted state and prevents the muscle from relaxing. When this occurs, this can actually prevent or result in a decrease in blood flow, decrease in oxygenation to the muscle, and this can result in pain. Here in the clinic, we actually do trigger point injections, and the goal of the trigger point injections is to break up that knot or top band, thereby resulting in the muscle relaxing, restoring oxygenation to the muscle structure and to the pelvic floor, and also result in restoring blood flow. Ultrasound is simply an imaging method that doesn't use radiation, and it gives us a visual of the anatomy, in our case in the pelvic floor, and it helps us guide the needle to the spot or the taut band of the muscle that's actually in a spasm or contraction. And by using an ultrasound-guided technique, we can actually pinpoint the exact spot to go to inject with a better outcome. And with the injection, we also apply a topical cold spray, which actually numbs up the area prior to the injection. So at the most, you may feel a pinch with the injection, but that's about it. It's a relatively painless procedure. Typically, you can go to work right afterwards. There's really no restrictions after the procedure is done. With regard to nerve blocks, we use what's called a hydrodissection technique. So we're essentially injecting about 8 to 10 cc's of fluid, anti-inflammatory medication into the muscle or fascial plane. And by injecting that amount of fluid or medication, we're essentially creating a space. And by creating a space, we're taking pressure off the nerve and also stretching the muscle out to get the muscle to relax. The treatment timeline is either 2 injections a week for 3 weeks or 1 injection a week for 6 weeks. The goal is to do it in a relatively short amount of time because we've realized that by hitting the muscle and the fascia over and over again, it has the best outcome to decrease the muscle hypertonic state, restore blood flow to the area, restore oxygenation, decrease the pH in the pelvic structure. Again, the goal of the trigger point injection is to break up the trigger point or top band that's keeping the muscle in contraction or spasm. By doing so, that gets the muscle to relax, and that once again promotes healing and decreases inflammation.